Hi guys. Okay. Sounds like there's a lot of confusion, so I just wanted to go back to the syllabus and kind of walk you through what to expect for tomorrow, because it sounds like there's really a lot of confusion going on. So if you would just watch with me for just a few minutes, and we'll get this all straightened out. Okay, so the first question that I have is if we're actually being tested on the lab tomorrow, and the answer is no. If you look at Monday the 25th, okay, we have exam 1, which is, is strictly a written exam, okay? It is 24 questions, but it's 25 points, okay? And that is all written. Okay, so until you see something that says kinesthetic, that is a hands-on demonstration. That is where you're actually showing me that you know how to demonstrate correctly vital signs, okay? On Friday, you'll have your second kinesthetic quiz. Neither one of these does require you to wear your scrubs, okay? So the kinesthetic quiz, if you look, sorry, bear with me as I arrow up here a minute. I want to get you to the right area. Okay, so the clinical attire here is strictly under the final head-to-toe assessment, okay? So that's the final head-to-toe assessment there, okay? So for the quizzes, you're not wearing anything special. It is just your normal clothes, except for what I have documented here on the syllabus, which is to wear 3/4 pants, 3/4 length yoga pants or shorts if possible, just so that you can see people's legs. Again, if you don't feel like doing it, that's okay. If you want to wear something over top, that's fine too. Okay, so again, just to review for tomorrow, exam 1 is completely written. Our first kinesthetic quiz will be on Wednesday, where you will literally just be going across the hall and meeting with Mr. Taffa for 10 minutes and just quickly doing a set of vital signs, obtaining it in the right order, and being relatively close in terms of your blood pressure reading. Okay, so that is the clarification on the exams. Okay, narrative note number 2. If you go and look, I posted this in the Desire to Learn classroom on Friday when we were in the lab, okay? So you're going to be writing your normal note, okay, your respiratory note. What I've put here is my narrative note that is a completely abnormal assessment, okay? What I want you to do is write a narrative note, okay, with the vitals that I've given you, okay? Or the vitals that you had on your first narrative note there, okay? And then I want you to go into your content, and this is, this is your content here, okay? You will find on Module 3 your normal findings worksheet. If you look here, your normal respiratory findings. Here, the airway and breathing are intact, skin tone is normal, respiration's even unlabored. They have normal chest expansion, no increased work of breathing or accessory muscle use noted, no retractions noted, no cough, normal cough or normal resonance throughout, and lung sounds are clear throughout all lung fields, and your respiratory rate of 12. So basically, what I want you to do is take this information here, so from your respiratory findings, and I want you to change out what I have here as abnormal findings, okay, and write a normal narrative note, okay? I'm happy to look over it, happy to give you feedback if you want to send it to me. Please do not apologize for asking me questions on a Sunday. I'm sitting at home here working, trying to put lectures together for you, so please do not apologize. I am entirely happy to answer questions for you, okay? So hopefully that makes sense to you, that this is what you do in terms of, oh, sorry, PowerPoint's launching. I'm not sure why it's doing that. So that is the clarification on the respiratory note. Okay, the other question that I had was regarding the respiratory case study. Okay, the respiratory case study, I have it due at 1300 because I do want to work on it in class a little bit. I'd like you to start working on it at home today, kind of start looking through it, think about it, answering the questions on your own. We will work on it, I'm hoping tomorrow in class together, and then you will submit your final copy to me. Okay, so again, try and work on that at home, and we'll work on it to finish it up tomorrow in class. Okay. Let's see. Okay, so that's that. Okay, so I think that's that question. Next question is should the narrative note be as long as my example or just the normal findings? Nope, it doesn't need to be as long as. I just want it to be your normal findings, okay? My purpose in having you do this is kind of to cement the idea of what the normal findings are. Okay, and we already talked about the case study, so I think that answers the questions. Yes. Okay, hopefully that answers the questions. Okay, if it doesn't, please let me know. And I hope you guys are doing well with your studying and you enjoy your Sunday evening. All right, so written exam only tomorrow. We're covering from the beginning of the class through lungs. Okay, that's all written. That will be on your computer, so please make sure that you bring your computer to class with you. Okay, and those of you who've talked to me and told me you don't have a computer, that's fine. I'll plug in some other ones for you. So I'll talk to you all tomorrow. Have a great day. Thanks. Bye.